Well, a new GPS system will be trialled at a Queensland hospital that tracks the movement of tumours in patients suffering from prostate cancer. Doctors at the Princess Alexandra Hospital in Brisbane will begin using the technology within days that is designed to avoid damaging a patient's tissue that surrounds the cancer. Radiation oncologist Tanya Holt from the hospital joins me now live. Thank you very much for your time today, Tanya. Can you explain how this body GPS works?
Thank you, Catherine, for having me on the last day of November, Prostate Cancer Awareness Month, to talk about radiation. So it's like a GPS tracking system for the prostate. So a little bit like when you're in your car and the GPS can track you within a few metres, this system tracks the prostate within within 1 millimetre of where it is. And it utilises 3 small beacons that are inserted into the prostate when the patient is asleep. And then those beacons talk to the radiation machine and every second send messages to the machine in terms of where the prostate is sitting at that exact time, such that if the prostate does move a little bit, the machine can be stopped until the prostate moves back to the position where it was when we started the treatment, and in doing so hoping to reduce the dose to the normal tissues, as you said, around the prostate.
So why is this better than traditional treatments? Is it that you're not adversely affecting the good cells around the cancer that you're trying to hit?
That's right. I mean, what we have to remember is that standard radiotherapy does use small gold seeds to localise the prostate very accurately. All standard radiation treatment is a very accurate, very precise treatment. What this does is it enhances that accuracy, and it does so by allowing us to potentially reduce the amount of normal tissue around the prostate that's within the treatment field, because we're tracking it so closely throughout the treatment.
And what are the problems associated or the side effects with a less directed or less targeted approach?
So the side effects of radiotherapy in general for prostate cancer patients are very little. It's a very well-tolerated treatment. Patients work throughout their treatment these days. But what it does do is it can cause some short-term and long-term irritation to the bladder and to the bowel, because the back passage sits directly behind the prostate. And so studies have shown that using a form of tracking the prostate during treatment, and Calypso is one such system that does that it allows us to reduce the dose to those tissues and therefore potentially reduce the long-term bowel and bladder side effects that patients may have after radiation.
And given that using the technology associated with the Calypso is more targeted, does it mean that you can increase the dosage of the radiation?
So what we do is we wouldn't increase the dosage, so it's certainly about accuracy, but it's more about reducing the side effects. But what we are trending towards worldwide with prostate cancer is using fewer fractions and bigger treatment doses, and in doing so potentially increasing dose for patients in that setting. And when we're doing that, Calypso becomes very useful because of that increased accuracy and decreased dose to the prostate tissue, the tissues around the prostate.
So you mentioned before that other treatments, such as using gold seeds when treating prostate cancer, is used. Which method is better, or are they just different?
So they're just different, and there are other what we call intrafractional monitoring the prostate during the treatment. There are other systems that do that as well. One of the benefits of Calypso is that it doesn't use any extra radiation because it's using radio wave frequency. The gold seeds is our standard treatment, and that localises the prostate, as I said, very accurately within millimetres. And you can use those gold seeds in some centres. They're starting to use those to track the prostate as well. But the Calypso system, I believe, is very useful in the fact that it doesn't have the extra radiation dose and it's very easy to use.
And so, Tanya, finally, before we let you go, what sort of hope does this offer cancer patients, prostate cancer patients?
Well, I think it just offers patients a sense of security that they're getting the safest and the best treatment available, and that we're really doing everything we can in radiation oncology to strive to give patients the best treatment cures and with the minimal amount of side effects, and the Calypso is one way to do that.
Tanya Holt, radiation oncologist, thank you very much for your time today.
My pleasure, Catherine. Thank you.